Hello, I'm Dr. Fredrick Echols, Health Commissioner for the City of St. Louis. This week, residents contacted the City of St. Louis Department of Health about COVID-19 testing hesitancy, breakthrough COVID-19 cases, and treatments for COVID-19. Barbara from zip code 63107 asked, I've been around a COVID-positive person and I feel fine. I don't want to get tested because I don't want to know whether I've got the virus. Do I still need to get tested? When it comes to your health, it is important that you have timely and accurate information about your body. That's why annual physical exams are recommended and regular exams for illnesses like breast and prostate cancer are encouraged. Knowing your status is the first step to advocating for your health. Getting exams or tests are the best way to know your status. Testing plays a key role in our efforts to contain and mitigate the spread of SARS-CoV-2, the virus that causes COVID-19. Testing for SARS-CoV-2 is important for identifying, tracing, and treating COVID-19 cases as well as informing policy decisions. Testing can help people determine if they are infected with SARS-CoV-2, regardless of whether they have symptoms and whether they are at risk for spreading the infection to others. Furthermore, testing helps identify people who are in need of care in a timely fashion. A positive test early in the course of the illness enables individuals to isolate themselves, reducing the chances that they will infect others, and allows them to seek treatment earlier, likely reducing disease severity and the risk of long-term disability and death. Randy from zip code 63110 asked, since people who are vaccinated can get the virus, why should I get vaccinated? The City of St. Louis Department of Health encourages individuals to get COVID-19 vaccines because the vaccines are effective at preventing serious illness and death. Most people who get COVID-19 and require hospitalization due to severe illness are unvaccinated. However, since vaccines are not 100% effective at preventing infection, some people who are fully vaccinated may still get COVID-19. These cases are called breakthrough infections. Fully vaccinated people with vaccine breakthrough infections are less likely to develop serious illness than those who are unvaccinated and get COVID-19. This means fully vaccinated individuals who become infected are much less likely to be hospitalized or die than people who are not vaccinated. Also, people who get breakthrough infections can be contagious and spread COVID-19 to others. However, fully vaccinated individuals who have underlying medical conditions may still require hospitalization, but the added protection that is granted by the FDA-authorized vaccines lowers their risk of dying due to their infection. Victor from zip code 63115 asked, are there treatments for COVID-19? There are several treatments being used for COVID-19 in St. Louis. One treatment that is being offered in the city of St. Louis is monoclonal antibodies such as bamlanivimab and etesevimab. This treatment has been shown to help keep certain high-risk patients from getting sicker and having to be hospitalized and prevent COVID-19 in certain people who have been exposed to someone infected with SARS-CoV-2. The antibodies are man-made proteins designed to fight off the virus that causes COVID-19. This treatment is prescribed for patients who have mild to moderate symptoms of COVID-19 and an elevated risk of complications. This treatment is also available for their household contacts. Data from clinical trials showed that high-risk patients treated with monoclonal antibodies had a 70% reduction in relative risk of progression to severe disease or hospitalization compared to patients who did not receive monoclonal antibodies. This treatment consists of a one-time intravenous or IV infusion followed by a 1-hour observation period. Your healthcare provider can help you determine if you are eligible for this treatment and refer you to Affinia Healthcare for treatment. They can call Affinia Healthcare at 314-449-3553 to speak with a treatment representative. These medicines are still being studied but have been approved for use under the FDA's Emergency Use Authorization Authority. For additional information about COVID-19 treatments, please contact the City of St. Louis Department of Health at health@stlouis-mo.gov. Thank you so much for tuning in this week. And thank you to Barbara, Randy, and Victor for submitting questions. Be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.